This podcast series consists of 4 episodes in total. They are all dedicated to EPICENSUS. EPICENSUS is a UCB-funded initiative to raise the standard of care for patients with psoriasis by gaining insights from patients, payers, and clinicians into the current standard of care and posing potential improvements. This series of podcasts has been financially supported by UCB Biopharma SRL. However, none of the podcast speakers have received any of the financial contributions for being part of this podcast. Welcome our listeners to the first ever episode of Europso's podcast, More Than Skin Deep. This podcast is aimed to uncover the true extent of the impact of psoriasis on patients' lives and question whether healthcare professionals are aware of the burden and the overall importance of considering individual patient needs in management. Psoriasis is caused by a dysregulation of the immune system, resulting in skin cells to grow abnormally fast, appearing as raised, red, scaly patches that can be accompanied by burning, itching, and stinging. Common areas affected include elbows, knees, and the scalp, but psoriasis can affect anywhere on the body. Psoriasis is a chronic, incurable condition and is non-contagious. Psoriasis affects men and women equally and often develops between ages 15 to 35. As psoriasis is an inflammatory disease and affects the immune system throughout the body, psoriasis is associated with other inflammatory diseases such as psoriatic arthritis, inflammatory bowel disease, diabetes, and heart disease. Despite advances in treatment options and management in psoriasis over recent years, substantial unmet needs in care remain that were first identified over a decade ago. My name is Jelena Misita. I'm a patient advocate with more than 2 decades of experience in healthcare communication. And my today's guest, and more of a co-host, is David Trigos. He is the Vice President of Europso from Spain and the former board member of IFPA. David has been living with psoriasis since 1998 and psoriatic arthritis since 2013. And apart from that, he is a vice president of Europso, coordinator of the Spanish national platform of EUPATI, involved in patient research partner in a huge range of psoriatic research projects at European and global level, and co-author of the Euroguiderm. So we are hoping today to bring this topic of psoriasis closer to you, especially from the 2 perspectives that David can cover better than most of other people. The one from the patient perspective and the other from someone who is deeply involved in organizational and advocating work of Europso. So David, welcome. And can you tell us more about yourself and your role at Europso?
Thank you, Jelena. It's a pleasure for me to be here today talking with you. I think this is something important for patients to make this podcast and for Europe. So it's a pleasure to arrange this kind of projects because we believe that it's important to show the patient journey of the patients, but not only, because as you know, we wanted to reach not only the patients, if not other stakeholders involved in the treatment of the people who is living with psoriatic disease. And this is why I think this is really important for us. And we need to move forward with this conversation, trying to show the others that living with psoriatic disease could be better if you are open to talk with other people and to open your heart to the people who are trying to find help. And for this is the aim of this podcast, and I'm sure we will enjoy with this podcast.
Well, this is the first time for us as well. The first episode is more of an introduction into this topic, and we would really cordially like to invite our listeners into learning more about psoriatic disease and then getting involved, helping us and reaching out to us so that we can further our cause. Europso stands for European Federation of Psoriasis Organizations, and it's actually 35 years old. This organization, it covers 21 organizations from 20 European countries. 14 of those are from the EU. And we hope, as you said, to influence other stakeholders as well, not just patients. For now, the aim of this podcast and more of a series of talks is that we uncover what are the unmet needs, what do we want as patients, and who can give it to us. So as we try to get further into this topic, we will have different guests, but these guests will always be from one of the interested sides. It will be either patients or healthcare professionals or patient advocates. So before we move to that, psoriasis can be a very complicated disease for those who are affected. Fortunately, it's not a deadly disease. It can be very dangerous if a person is suffering from a very rare form of psoriasis called GPP, general pustular psoriasis. But for other forms of psoriasis, even though it affects someone's life significantly, it can get unnoticed by healthcare decision makers or even medics. So the general experience of patients and people who are with us in Europso, experiencing this on their own skin, quite literally, is that quite often they are searching for diagnosis for a long time instead of getting diagnosed quickly. Therefore, their treatment is delayed. And even when the treatment gets to them, sometimes it's not correct for their own particular type of psoriasis. So, David, what is your experience, personal experience with psoriasis? As we said, you are a patient.
Thank you, Jelena, for your question. So, my life with psoriasis is a long journey. It's a long journey. So, as you explained it, I was diagnosed 25 years ago with the skin disease. I can say that I have bad luck because I suffered all the bad things that a patient who is suffering psoriasis or psoriatic disease can suffer. Because I was diagnosed with the skin disease in 1988. And after that, I've developed the psoriatic arthritis. So because of this, I changed all my life because finally all these problems are impacting for your life. And the main was that due to the development of the disease, I've developed other comorbidities. In this case, I've developed diabetes. And after all, I suffered cardiovascular issues. I had a heart attack 2 years ago. So I can say that I have a really bad luck. Instead, I was really good treated and I had a really good connection with my dermatologist, with my rheumatologist. But overall, I had all these issues being well treated. So I don't want to know if I was untreated at that moment, what would be my life. Probably all these episodes were occurred before in the time. And of course, the quality of my life would be really, really worse than was in the reality. And this is why I can say that I have bad luck, but in the other hand, I have a really good luck. I have a really good luck because at the moment that I connected with a patient organization in Spain with acute psoriasis, so I knew a new world for me, a new environment where I can, at that moment, I felt really, really comfortable because I felt that all the people understood my feelings, understood the things that I tried to explain to the others. And for me, it was really, really, really important in my life to find this patient organization, Acción Psoriasis, because finally they show me that we can have a lot of opportunities and overall we can have a lot of people who can understand and who can help you to spread the word, to spread the word about your disease.
So in a way, you would say, and circling back to the main topic of this introductory episode, is that psoriasis is more than skin deep. As we saw from your example, psoriasis affected you in more different ways, not just as a skin disease, but also through other comorbidities. But as you said, everything gets easier when you get affiliated with an organization that can help you, that can support you with information that will make you feel less alone. And this is kind of a point of patient organizations in the first place. So do you think that throughout your journey, from the moment that you are diagnosed and treated, and it's been a lot of time, more than 25 years now, do you think that healthcare professionals recognize the full burden of psoriasis? those professionals that you met through your professional life as a patient advocate, but also as a patient in person, do you think that they really see the full burden of psoriasis? What is your honest opinion on this?
I think that this is something that has improved a lot during the last 25 years. So I remember 25 years ago, the communication with your healthcare providers was not zero, but close to zero. And the paternalism of the treatment of the patients was totally installed in the society. So this is something that has improved a lot in the last 25 years. And I think that this is something that we need to continue work on it. We need to improve this knowledge of the healthcare professionals about the disease, because it's really important to involve them in a holistic way to see your disease. And I think it's one of the main points for the patients, not only the access to the treatment, it's not the access to this holistic treatment of the disease, to attack the problems in the moment that you need to be treated.
When you say holistic approach, do you think about healthcare professionals being aware of your treatment goals? And how involved is a patient from your perspective? And also, there was this EPICENSUS program, which mainly focused on unsatisfied needs and what is needed to satisfy them. So what do you think? Are your healthcare professionals aware of your treatment goals? Is this something that you discuss together? Or a medical professional decides what is the treatment goal and the patient is just to follow the guidelines?
I think one of the main points is that the shared decision of the treatment goals should be something that will be over the table always. When you are talking with your healthcare professional, with the dermatologist, with the rheumatologist, with the primary general physicians, with the nurses, we need to involve all the healthcare professionals in the treatment of your disease. And I know this is something really difficult because not all the countries in Europe, for example, has the same way to treat the disease. And this is something that we need to eliminate. We need to quit this problem. We need to try to find this equity between the treatment in one country or other country, or one region or other region. We need to break this wall. We need to use the guidelines, but the same guidelines for all, and always trying to find the better treatment and the better care for the people who is suffering psoriatic disease. And this is something that we need to work, and we need to continue working on it in the following years, because it's something that is really, really, I think, important. Not only important, it's I think one of the more important things for the person who is suffering the disease to be treated correctly and to be treated in the correct moment. And for this, we need to help the healthcare professionals to know about the disease. I know this is something that, as I told before, that they improved during the last years, but we need to continue working on that. And we need to continue showing that this is the way we need to follow.
There is a word that I just mentioned, and it occurs to me that this word especially deserves an explanation, which is EPICENSUS. EPICENSUS is the name of a project that is actually broader than an average project. It's actually a UCB-funded initiative aimed to raise the standard of care for patients with psoriasis. And it's doing it by gaining insights from patients, payers, clinicians, which provide insight into the current standard of care and propose potential improvements. So EPICENSUS actually found that payers and healthcare professionals need to better appreciate the total burden of psoriasis over the lifetime of patients, which perfectly correlates with your experience and what you just explained before. And there is also, of course, a series of calls to action to improve care and to ensure that patients' goals and burden are recognized and shared with their healthcare professionals. So basically what we need and what you reconfirmed is to integrate patient needs in decision-making. That's why I actually asked you, is your treatment goal something that a doctor just tells you? And I figure things were different 25 years ago and now. And I'm glad that you say that things have evolved But what do you think about these findings from EPICENSUS? Are we there yet? And how far along do we have to go to get to this perfect lineup with healthcare professionals where we make decisions together about the treatment?
I think we are so far. In my personal opinion, we are so far. On the other hand, we don't have enough time to make possible these points that we found in EPICENSUS, because are really, really critical. Because at the European level, the new health strategy was presented 3 years ago, but now we are having a lot of different changes, including the new HTA regulation, the new draft of the pharmacy legislation, or the European pharmacy legislation, that are really, really, really important for us. And many of these points are really important because will be important at the moment to take the decisions, okay, in after the application of these new regulations. And if we don't work together, trying to find the best way to treat a patient, if we cannot work together, I want to say, if we cannot work together, we are lost. We will be missed in the line. And for this, and of course, this is something that could be really dangerous for people who suffer in psoriasis or psoriatic disease, because they can find that are not well treated and developing all the issues that they can have. Overall, I think the main issue is that we can find one person who cannot have the correct access to the correct treatment in the correct moment. And this is why it's really important to work together now. We cannot spend more time waiting. Oh, we need to know to improve these points. Yes, but we need to move forward and we need to make it now. The moment is now, because the future is now. The future is now.
When you say we need to do it together, who is we? Who do you refer as we?
Okay, it's important to work with the healthcare professionals, and just in this point, I include all the healthcare professionals, not only dermatologists or rheumatologists. This is why it's really important to educate the healthcare professionals, but not only dermatologists and rheumatologists, not primary care or the general practitioners, the nurses, and of course, it's really important the psychological part. And for this, it's really important to have this specific people that is working in the psychological part for psoriatic patients, because these points are really important to show the quality of life of the people who suffer in psoriatic disease. We know what the psychological issue that the person who has psoriatic disease is one of the main points to treat to have the correct treatment. It's not only the medicines that you are taking, if not all the other parts that are really important for your life. And this is why we need to work, and not only with the healthcare professionals, we need to work with the other stakeholders, the payers. We need to involve the politicians. We need to involve all the stakeholders that are involved in the decision-making for the patients. Because finally, this is something that can make the decisions a better decisions. So we need to work together. We need to involve all the stakeholders that are involved at the end in the treatment. In the treatment are involved all healthcare professionals, I repeat, payers, politicians, and people, the decision makers at the end. And this is why we need to involve all in this work.
So in a way, if we want to summarize this first episode's takeaway points, and based on your experience, what patients can do to communicate the burden of psoriasis and their treatment goals?
It depends if we are talking of an individual patient or a patient representative. There are different roles, and we need to know that we need to make these roles something different. And the way to spread the word is totally different. As an individual, of course, you need to, overall, to find someone that can help you to improve the knowledge of the disease. This is really important. You need to know your disease, and after that, you can make questions to your doctors, to your nurses, to the people who is living with you. And this is a way for an individual person to improve the pathway of the treatment, no, of their own disease. And in the other hand are the patient representatives and the patient organizations, which role is totally different. In this case, as patient representatives, we need to be involved and to spread the word, not only with politicians, with other stakeholders, as for example, healthcare providers, healthcare professionals. If not, we need to spread the word with the world, and with the people. And for this, I think social media today provide us the possibility to spread the word and to make really interesting campaigns to improve the knowledge about the disease, and campaigns that can help these individual patients to improve their knowledge about the disease. And this is why I think patient organizations are really important. The national organizations are really important. Europso is really important. EPA is really important. And we need to move forward and to work together, as I explained before, to spread the word, to improve the knowledge about the disease, not only for the stakeholders, if not for the people in the world. And I think this is the way to continue working. And it's something that I'm trying to do every day. And I'm trying to make not only for the psoriatic disease, if not for the knowledge of all the environment of the psoriatic disease. And we need to continue making this. And we have the possibility, not only with this podcast, if not with all the projects that we are developing in Europso and in the national organizations that are members. So we need to move forward.
Thank you, David, for this valuable insight and your unique, especially from your unique perspective as both patient and patient advocate. I think this is quite some information for the first episode, and we hope that we just open the door for other people to see what we are doing at Europso, to get a flavor of what we plan to do in terms of communicating the burden of psoriasis and treatment goals, but also further advancements in treatment options and especially access to treatment. So I would like to thank you for today. This is a little bit strange situation because we know each other well, and now we are co-host of this first episode. But we hope that with the next episode and other guests, our listeners will get even more information. And especially because our next episode is Education for All. It will cover the need for education for everyone involved in the psoriatic patient's journey. So this is not something affecting one person. We all know that if a disease affects a family member, the whole family needs to know as much as possible. We will talk about the importance of learning about the psoriasis and why it's important to know it if you want to treat it. Thank you, David. And do you have any closing remarks from your side?
Not the only is to invite the people to continue hearing this podcast and to overall, I think, to enjoy with this podcast and to help us to spread the word. And thank you, Jelena. And you talked about we normally meet to work, and today this is more personal, and I really like this. I really like this because it's a way to show the others the burden of the disease, and for this is really important. So thank you to all the people who can hear us, and thank you, Jelena, of course.
Thank you, listeners, and please follow us for more information. Until our next episode, we wish you goodbye.